my name is Stacy Madrid. Today's date is June 22nd, 2019, and this week is week 7 lab video regarding the anatomy of the urinary system of the fetal pig. So I'll be going over 8 particular structures of the pig, and then I just want to let you know that I'm not wearing my goggles because it fogs up when I try to look at the sites, and I'm not wearing my mask either so I can talk clearly, okay? So if you look at the pig, you can see we already cut the thoracic, we already cut the portion where the diaphragm's at, and the abdominal region. You can see the heart here and the lungs. The diaphragm, the liver is right up here, the stomach, and on the side right here you can see the spleen. I'm gonna take that out. In the instructions we had to do certain incisions on the side, down here, and even up here, so we can expose the abdominal cavity. I went and pushed this down, but right here are the small intestines, as you can tell. All this stuff right here, and if you go all the way to the back, the small intestine that goes into the large intestine right here, okay? So I'm gonna take that out, and it was kind of connected down to a tissue covering the kidneys, and that was the peritoneum tissue, so that covered it. In order for me to get to the kidney area, I had to cut that portion out, but that's what surrounds it. So I cut that tissue out of it to go ahead and expose the kidney. This is my left one, and I actually dissected already out the right one, but it was for the picture of the assignment. I had to cut out the right kidney, and then here is the left kidney, as you can see. So there's 8 structures I have to go ahead and name. Right here you can see the kidney, and I already took out the right one. I already put it aside. So here's the kidney. This part right here through the middle, and up here you can see is the aorta. But so here's the kidney. If I follow it down, here is a ureter, and then tracing it all the way down, it comes to this right here. I was a little bit confused to see where the bladder was because the picture showed differently, but right here it tells me it's where the bladder is at. So that's the urinary bladder, the ureter's kidney. And if you look really in, this up here is the renal vein, and then underneath the renal vein you can actually see the renal artery, and right here it connects into the aorta. Okay, so that's the function right there. You can even see like it coming out right here, the dye. So I'm gonna go ahead and go into the outside, but another portion I want to show you right here is the fat around the kidneys. It shows right here. You can see you can cushion on the top part. So this is the cut of the right kidney. I'm gonna go ahead and take this top part. I want to show you the inside of it. Right here you can see the dye again. Here is the the renal vein. And then on this aspect you couldn't really see the renal artery, but if you flip it, right there you can see the renal artery. You can tell by the blood tinge right there, renal artery. So usually the renal artery is behind the renal vein. And then again, this is the ureters that go down to the bladder. So this is the inside of the kidney. And then right here, you can go ahead and tell it's the renal cortex. So that's the outside portion of the kidney. And then the inner part, where if you can see, like me spreading it, you can kind of see the little areas. That's the renal medulla. Okay, so we are aware that there's the functional unit of the kidneys is a nephron, and each nephron unit has a glomerulus that's inside of the renal cortex and goes down into the renal medulla with the Bowman's capsule. And right there it will show you the proximal convoluted tubule to the loop of Henle to the distal, and the filtrate that will be released is urine, which will be leaving out the ureters down to urinary bladder and be excreted after the urinary bladder. So that is pretty much the portion or the anatomy of the urinary system. So thank you.